Ever feel like you're juggling, I don't know, a dozen plates? And just when you think you finally got it handled, someone tosses another one onto the stack.
Mm,
That feeling, that constant pressure, that sense of just being overwhelmed, well, it's pretty universal, right?
absolutely. We all know that feeling.
So today, we're taking a deep dive into something incredibly relevant to all of us, but especially, crucial for you as future nurses: stress management. And this isn't just about feeling a bit frazzled sometimes. It's really about understanding a critical piece of health and well-being for you and for your patients.
Exactly. And for this deep dive, our source material is really solid. We're pulling from a comprehensive chapter on stress management in Lewis's Medical Surgical Nursing, the assessment and management of clinical problems text. Our mission really is to distill the key insights from this, how stress affects the mind, the body, the spirit, all of it. We want to equip you with practical tools to recognize and manage stress, both in yourselves and, importantly, in your patients. Think of it as a roadmap for your nursing practice. We'll touch on pathophysiology, risk factors, manifestations, and nursing management.
Okay, sounds good. So let's unpack this then. To really manage stress, we have to start right at the beginning. What exactly is stress?
Yeah, that's the fundamental question. Our reading makes it clear it's not just a feeling. It's
Mm.
defined as the inability to cope with perceived demands or threats. And that word perceived is really key here. It could be real or imagined, but it impacts our mental, emotional, or spiritual well-being.
Right, so it's less about the event itself and more about how we interpret it. The reading makes an interesting distinction there, doesn't it, between stressors and stress?
It does. Stressors are the events, the factors causing the pressure, like, say, acute pain after surgery or an infection, or even the fear surrounding a potential diagnosis. Stress, then, is our response to those stressors.
And these stressors can be anything, really.
Oh, absolutely. They can be physiologic, like I mentioned, surgery recovery, or they can be emotional, psychological,
Hmm.
things like losing a loved one, or maybe surprisingly, even positive events like having a baby.
Because even good things require adaptation.
Yeah.
Right, change.
Exactly. Significant adaptation.
That perception angle is huge. The book gives some really striking examples, like BJ, the 43-year-old woman who gets depressed after what seems like a simple hysterectomy for fibroids.
Right. To the healthcare team, maybe it seems routine, but for her, it felt like a loss of womanhood, a major psychological stressor for her.
Hmm.
Or think about KR, 52 years old, who's actually relieved to get a type 2 diabetes diagnosis.
Relieved. That sounds counterintuitive.
It does, but she was terrified it was cancer.
Hmm.
So for her, diabetes, while obviously serious and stressful in its own right, was the better outcome compared to her fear. It just hammers home how individual stress is. You really have to assess beyond the surface level as a nurse.
And it's not always a negative thing either, is it?
Hmm.
We tend to think stress is bad,
Right.
but the chapter points out that a little stress can actually be helpful. Like for you as a nursing student, maybe studying for a big exam.
Mhm.
That mild stress can motivate you, sharpen your focus.
Hmm.
But too much stress,
Mm.
that's different.
Totally different. That's when you hit the wall. Mental blocks, can't concentrate, forget things you studied.
Yeah.
And the body's physiological response, it doesn't really care if the stress is good or bad, or even if the threat is real or just imagined. It fires up the same systems.
Wow.
And something really striking in the reading is the prevalence data. It mentions women tend to report stress more through physical symptoms, anxiety, depression, maybe seeking help more often.
Yeah.
But men, perhaps surprisingly, are actually more likely to die from stress-related illnesses.
Really? Why is that?
Well, the text suggests it might point to differences in how stress manifests, or maybe how it's managed, possibly underreporting or delaying seeking help in men. It's definitely something for us as nurses to keep in mind.
That's a powerful point.
Yeah.
So if stress is so individual and the response varies,
Mm-hmm.
why do people react so differently? Why do some seem to handle things better?
It's a great question, and it really points to why we need that holistic nursing assessment. So many factors are involved. Obviously, there's the type of stressor, how long it lasts acute versus chronic, and how intense it is, mild, moderate, severe.
Sure.
But beyond that, our material really digs into crucial internal and external factors that influence how someone copes.
Internal factors, like what specifically? What makes us different on the inside in how we handle stress?
Well, the reading highlights several key internal characteristics. Things like your age, your general health status, nutrition, even how well you're sleeping, all those play a part. But two concepts really stand out as buffers: resilience and hardiness.
Okay, resilience and hardiness. Tell me more about those.
So resilience is about being resourceful, flexible, good at problem solving. People high in resilience are maybe less likely to see something as overwhelmingly stressful in the first place.
They bounce back better.
Kind of, yeah. And hardiness is slightly different. It's this combination of commitment, feeling a sense of control, and being open to change. It gives people the sort of courage to see stressful things as challenges, maybe even opportunities for growth.
I can see how those would make a huge difference. What about attitude? Does that play in?
Big time. The reading emphasizes how a positive attitude, being optimistic, isn't just about feeling good mentally. It can actually help prevent disease, promote quicker recovery. Yeah. Whereas someone with a more pessimistic outlook might deny problems, let stress kind of derail their goals, and that often links to poorer health outcomes.
Fascinating. So those are internal factors.
Yeah.
What about things outside of us, external influences?
Right, those are crucial too. Things like cultural or ethnic background, the sheer number of stressors someone's facing at once, that juggling analogy you used earlier.
Mm-hmm.
Also, religious or spiritual beliefs, socioeconomic status, they all matter. But maybe one of the biggest external factors is social support.
Ah, having people around you.
Exactly. A strong network, friends, family, support groups can act like a massive shock absorber. It really helps when the demands feel like they're exceeding your own resources.
That makes total sense. That holistic view is so important for planning care. But okay, let's get into the nitty-gritty. What's actually happening physiologically?
Yeah.
When that stress response kicks in, what's going on inside our bodies? It's like an alarm system, right? Yeah.
It is, precisely, a very intricate one. The main players are the nervous system, the endocrine system, and the immune system. And they're all interconnected, constantly talking to each other.
Okay.
This interplay dictates the whole physiological response, and it impacts pretty much everything else: cardiovascular, respiratory, GI systems, you name it.
So starting with the nervous system, the brain's the command center, right? The
Yeah.
cerebral cortex.
Yep. The cortex is where we perceive and evaluate the stressor. We draw on past experiences, figure out what this means. That influences the response.
And then deeper in.
Deeper in, you've got the limbic system, sometimes called the emotional brain. It mediates emotions, survival instincts. And then there's the reticular formation, which contains the RAS, the reticular activating system.
RAS. What does that do?
That's what increases alertness, ramps you up. But ironically, when stress is high and it's overactive, it's often why people have trouble sleeping. A really common complaint we see in patients.
Oh, okay. And the hypothalamus. I remember that being central.
Absolutely central. It's the bridge, really, connecting the nervous and endocrine systems. It gets the ball rolling by stimulating the sympathetic nervous system, the SNS, our fight or flight system, and by releasing a key hormone called CRH, corticotropin-releasing hormone.
That's the activate.
That CRH acts like a messenger to the pituitary gland.
Got it. Which leads us straight into the endocrine system's role.
Exactly. So the SNS stimulation hits the adrenal medulla, triggering it to pump out epinephrine and norepinephrine. Those are the classic fight or flight hormones, the catecholamines.
Right. Adrenaline rush.
That's the one. And that causes the cascade. Heart rate speeds up, stroke volume increases, so cardiac output goes up, blood sugar rises for energy, breathing gets faster, blood vessels in the periphery constrict to shunt blood to vital organs. The body's getting ready for action.
Okay, so that's the immediate sympathoadrenal response. But you mentioned the HPA axis too.
Yes, the hypothalamic pituitary adrenal axis. So back to the hypothalamus releasing CRH that tells the pituitary gland to release ACTH, adrenocorticotropic hormone. And interestingly, the pituitary also releases beta endorphins at the same time.
Endorphins, like natural painkillers.
Exactly. They provide a bit of an analgesic effect, which might help blunt pain perception during a stressful event.
Huh. And the ACTH, where does that go?
ACTH travels to the adrenal cortex, the outer part of the adrenal gland, and tells it to release corticosteroids. The main one we talk about is cortisol.
Ah, cortisol. We hear a lot about that one. What's its job here?
It's crucial. Cortisol does a few things. It helps increase blood glucose even more, providing sustained energy. It also intensifies the effects of the catecholamines, and it has anti-inflammatory effects. But maybe most importantly, cortisol helps to regulate or turn off the stress response once the threat has passed. It suppresses certain immune responses. Without cortisol, the stress response could just keep going and become damaging itself.
Wow. So it's both part of the on switch and the off switch in a way.
In a way, yes. It supports the adaptive response, but also helps prevent it from going haywire.
Incredible how the body manages that. Now, the immune system, you mentioned it gets involved too. How does stress affect our immunity?
Yeah, this is really fascinating territory. It falls under psychoneuroimmunology, or PNI.
PNI, okay.
It's the science of how the mind, the brain, the nervous system, and the immune system all communicate. It really shows that stress isn't just in your head, it directly impacts your body's defense system.
So stress can literally make you sick.
It can make you more susceptible, definitely. The connection PNI reveals shows how stress can weaken the immune response. Our reading points out that both acute and chronic stress can decrease the activity of natural killer cells. Those are key defenders. Reduce how well other immune cells multiply, change the chemical signals they use, and decrease phagocytosis, which is how cells engulf invaders.
So that's like lowering the shields.
Pretty much, yeah. It puts
Yeah.
your body's defenses on the back foot.
Okay, so summing up the acute response. Increased SNS activity, faster heart rate, faster breathing, higher BP, muscles tense up, brain's more active, skin gets cooler.
Yeah.
That whole alarm system is firing.
That's the snapshot, yes.
Which brings us really nicely to this idea of the mind-body-spirit connection. The reading emphasizes how interconnected these are. What happens mentally affects us physically, right?
Absolutely. And our spirit, our sense of purpose or peace is often renewed when both mind and body are in balance. It's a delicate equilibrium.
And maintaining that balance isn't just crucial for patients. It's vital for nurses too, isn't it?
Oh, incredibly vital. Nursing is stressful.
Yeah.
The work environment, the physical demands, dealing with difficult situations, even tension with colleagues. It all adds up. You really have to maintain your own mind, body, spirit balance to provide good care and, frankly, to survive and thrive in the profession.
Yeah, definitely. So we know acute stress is an alarm, but what happens when that alarm just keeps ringing? Chronic stress.
Yeah, that's where things get really problematic. Our reading talks about diseases of adaptation or stress-related illnesses emerging from chronic, unrelieved stress.
What kinds of illnesses are we talking about?
The list is long, unfortunately. The text gives examples like depression, fibromyalgia, hypertension, insomnia, irritable bowel syndrome, IBS. Many common conditions have a significant stress component.
And it affects more than just physical health, right?
Yeah.
Thinking, behavior.
Definitely. Chronic stress often leads to poor concentration, memory problems, maybe social withdrawal, changes in eating habits, increased irritability. You see these cognitive and behavioral shifts.
And that lowered immunity we talked about. Does that make you more likely to catch things?
Yes. There's classic research mentioned, like the Cohen study showing people under high psychologic stress were more susceptible to the common cold when exposed to the virus.
Wow.
And even at the cellular level, the chapter touches on the link between chronic stress and shorter telomeres.
Telomeres. Those are the caps on our chromosomes.
Exactly. Shorter telomeres are linked to faster cell aging, so chronic stress might literally be accelerating the aging process at a cellular level.
That's sobering. Okay, so stress is everywhere. It can be harmful, it's chronic. What can we actually do about it? Let's talk coping.
Right. Coping. The book defines it simply as a person's efforts to manage stressors. And importantly, coping can be positive or negative.
Positive like exercise, talking to friends.
Exactly. Things that genuinely help manage the stress or the reaction to it. Negative coping, on the other hand, might be things like substance use, overeating, maybe just denying the problem exists.
Which might feel better short term, but
Usually makes things worse long term.
yeah.
Identifying those negative patterns is a key nursing role.
Okay. The reading also breaks coping down into two main types, emotion-focused and problem-focused. Can you explain the difference?
Sure. Emotion-focused coping is about managing the feelings associated with the stress. It's often used when you can't change the situation itself, like discussing your feelings, maybe doing some deep breathing, taking a hot bath, meditating. The goal is to decrease the negative emotions.
Okay. And problem-focused.
That's about tackling the actual problem causing the stress, assuming it can be changed or influenced. It involves analyzing the situation, setting priorities, gathering information, seeking advice.
So if you failed an exam, problem-focused might be figuring out a better study plan.
Exactly. Whereas emotion-focused might be talking to a friend about how disappointed you feel.
And often you use both.
Very often, yes. The reading gives examples, like with a new diabetes diagnosis. Problem-focused is learning about diet and insulin. Emotion-focused is maybe joining a support group to deal with the feelings about having a chronic illness. You need both.
That makes sense. It's about having a toolkit. Which brings us to relaxation techniques. The book talks about eliciting the relaxation response. What is that exactly?
It's essentially the physiological opposite of the stress response. It's a state of deep rest, characterized by decreased sympathetic nervous system activity.
So lower heart rate, slower breathing.
Lower blood pressure, less muscle tension, calmer brain activity, warmer skin temperature. It's the body's natural off switch for that fight or flight state.
How do we flip that switch? The book lists quite a few strategies.
It does. And one of the most fundamental, accessible ones is relaxation breathing.
Just breathing differently.
It sounds simple, but it's powerful. Stress often makes breathing shallow and rapid, right up in the chest. Deep, slow, diaphragmatic breathing from the belly actually stimulates the vagus nerve, which helps calm the nervous system.
How do you teach that?
Well, the chapter suggests first assessing how someone breathes. Put one hand on the chest, one on the abdomen. For relaxation, the abdomen hand should rise more. Then, guide them. Inhale slowly through the nose. Feel the belly expand. Maybe think peace. Exhale slowly through the mouth. Feel the belly fall. Think tension release. Repeat maybe 10 times. And critically, as a nurse, you need to learn and practice this yourself first. Then you can teach patients effectively. It's great for anxiety, pain, even during procedures.
Such a portable tool.
Yeah.
What else is in the relaxation toolkit?
There's biofeedback. That involves using monitoring equipment to become aware of and eventually control involuntary responses like muscle tension or heart rate.
Okay.
Meditation is another big one. Focusing attention on a sound, an object, your breath. It increases awareness, quiets the mind, reduces stress. Simple guidelines. Quiet place, comfy position, focus word or phrase, relaxation breathing, even short sessions help.
And imagery. Using your mind's eye.
Yes. Guided imagery. Our material describes creating a special place in your mind. Close your eyes, imagine somewhere peaceful, engage all your senses. What do you see, hear, smell, feel there? It's like a mental vacation.
That sounds lovely. Does it have specific clinical uses?
Oh, loads. Besides general stress and anxiety reduction, it can be used for pain management. The book even gives examples of disease-specific imagery, like picturing strong cells rebuilding bone and arthritis, or visualizing immune cells attacking cancer cells. It can help patients feel more active in their healing.
That's powerful. What about touch? Massage?
Massage is great for reducing muscle tension, promoting relaxation, and just offering comfort. Now, nurses aren't typically registered massage therapists, but simple techniques like a gentle back rub at bedtime or even a hand massage for an anxious patient can make a real difference.
Music is mentioned too.
Yeah, music therapy. The right kind of music can definitely elicit the relaxation response, decrease anxiety, help with sleep. Preferences vary, of course, but often music around 60-80 beats per minute, maybe classical or instrumental, works well.
And prayer.
For many people, prayer is a very important coping and relaxation strategy. It's a form of meditation, really. It can provide comfort, perspective, strength, inspiration, a deep sense of peace for those who practice it.
Okay, so we have this understanding of stress, the responses, the coping methods, the relaxation techniques. How do we, as nurses, bring all this together in practice? What's our role?
Our role is central. The reading emphasizes that nurses assess stress in both patients and their families or caregivers. We identify periods when stress might be particularly high, and we implement strategies to manage it and prevent negative outcomes. You're really orchestrating this aspect of care.
Assessment first, always. So asking about stressors.
Yes. Awareness is step one. Asking things like, what's been most stressful for you lately? Have you dealt with something like this before? What helped then? What didn't?
And looking for the signs and symptoms we discussed.
Absolutely. Physical signs. Elevated heart rate or BP, maybe headaches, muscle tension. Behavioral signs. Trouble concentrating, irritability, changes in sleep or eating. Cognitive signs. Forgetfulness, difficulty making decisions. You need to observe and ask.
But don't forget the caregivers.
Critically important. Assess their stress too. How is the patient's illness affecting their job, their finances, their own health, their family life? You need that full picture for holistic planning.
So once we've assessed, what are the goals? What are we aiming for?
Overall goals usually include the patient reporting decreased stress levels, demonstrating positive coping strategies, and ideally, remaining free from preventable stress-related complications like delayed wound healing or infections.
And then implementation. Putting the plan into action.
Right. Interventions depend heavily on the situation. For a critically ill patient, it might be about ensuring basic needs are met, minimizing noise and sleep disruption. For someone less acute, it's about teaching and reinforcing those coping and relaxation strategies we talked about.
How do we integrate that smoothly?
The text suggests nurses should first learn and practice relaxation breathing themselves. Then, choose strategies appropriate for the patient and setting. Maybe attend workshops to build skills. The key is tailoring it, offering choices so the patient feels some control, and making sure the strategy itself doesn't become another stressor.
Good point. And knowing when to refer.
Essential. Recognize when a patient needs more specialized help from a counselor, psychologist, or psychiatrist. Know your scope and resources.
And finally, maybe most importantly, nurse self-care.
Yes, cannot emphasize this enough. The reading has great tips. Don't try to be superhuman. Learn to delegate, let things go, prioritize exercise and sleep. Talk about your feelings with trusted peers, find humor, resolve conflicts constructively.
You have to put on your own oxygen mask first.
Precisely. You simply cannot pour from an empty cup. Caring for yourself is fundamental to being able to care effectively for others.
Okay, let's tie this back to a clinical scenario, like the KFK study mentioned in the reading. The 48-year-old Romanian immigrant, divorced, no family nearby, working 2 jobs, presenting with fatigue, insomnia, aches.
Right. So thinking about her, what are the obvious risk factors contributing to her symptoms? You've got the recent move, the divorce, the lack of social support, the financial pressure from 2 jobs. It's a perfect storm.
Definitely.
So then, given her intense schedule and likely limited resources, what limitations do you need to consider when suggesting coping strategies? What would be priority interventions for her care plan? Maybe starting with simple relaxation breathing she can do anywhere, focusing on sleep hygiene.
And cultural factors too, right? Her background might influence how she expresses stress or what coping methods feel comfortable.
Exactly. You need to consider that. These are the kinds of critical thinking questions that bridge the textbook knowledge to real-world nursing practice. It's about seeing the whole person.
This has been a really insightful deep dive. It's so clear that stress, while, totally pervasive, is manageable.
It is.
And that perception is key. The body's response is complex, involving multiple systems, and nurses play such a vital role. Assessment, teaching, facilitating relaxation. That mind-body-spirit connection is central.
Absolutely. And maybe a final thought for you, the listener, to ponder. Considering how deeply stress impacts literally every body system, how might really understanding stress management empower you? Not just for individual patients, but maybe to advocate for bigger systemic changes in healthcare environments, changes that support the well-being of both patients and the staff caring for them.
That's a powerful question to carry forward. We really hope this deep dive into stress management has given you some valuable nuggets of knowledge, some practical strategies you can start using today, both for yourself and in your future nursing career. Thank you so much for joining us on the deep dive.